Hi, everybody. Thank you for listening in today to part 2 of our Teen Matters Meeting the Needs of Adolescent Youth. My name is Kelly Jones, and I am a Senior Program Associate with Children and Family Futures. We are a national nonprofit organization that strives to prevent child abuse and neglect while improving safety, permanency, well-being, and recovery outcomes for children and parents and their families affected by trauma, substance use, and mental health disorders. Children and Family Futures also operates the National Family Treatment Court Training and Technical Assistance Program, which is funded by the Office of Juvenile Justice and Delinquency Prevention, or OJJDP. This post-webinar podcast is supported by OJJDP, and the opinions expressed here do not necessarily reflect those of OJJDP, yet we thank them so much for their support. So we are very excited to continue this discussion today. The purpose of today's podcast is to continue those robust conversations that we had with all of our panelists from the Teen Matters Live Cafe conversation. Panelists, if you could briefly just introduce yourself by providing your name, your role, and a little bit about yourself, starting first with Judge Anthony Capizzi.
Thanks, Kelly. I'm Tony Capizzi. I'm a judge in Montgomery County, Ohio. I'm the administrative judge of the juvenile court. I've been a lawyer for 25 years and a judge for 16. I preside over the largest treatment court, juvenile treatment court in Ohio. I also have a juvenile mental health court, and I have a family treatment court. So pretty focused on specialty dockets in this community. I'm also past president of the National Council of Juvenile and Family Court Judges.
Great. Thank you so much, Judge. Dr. Martha Blomquist, if you could go ahead and introduce yourself too.
Thank you, Kelly. Hi, everyone. I'm Martha Blomquist. I'm a senior site manager with the National Council of Juvenile and Family Court Judges. And as some of you may know, we provide training and technical assistance to judges and court-related teams around the country in several program areas, including child welfare and also juvenile justice, and in particular, juvenile drug treatment court teams. I'm really pleased to be part of this second conversation on Teen Matters. I think that's a tribute to the topic and how much interest there is in the topic. And it's really great for me to continue to share what I know and to be with my colleagues and responding to your questions and providing support to all of you as you work with families and youth.
Great. Thank you, Martha. Janelle Scrignoli, please go ahead and give us a brief introduction.
Good morning. I'm Janelle Scrignoli. I was the program administrator for Snohomish County, Washington for all of the therapeutic courts, including adult, family, and juvenile programs, recently retired. And now I'm participating with the National Association of Drug Court Professionals as faculty, providing training and technical assistance to treatment courts wherever they need. Thank you.
Great. Thank you so much, Janelle. We're also happy to have Wendy Schiller from the National Council of Juvenile and Family Court Judges joining us today. Wendy, can you go ahead and introduce yourself, including your role, and share why it is that you care so much about this particular population?
Yeah, sure. Thank you. And I'm happy to be joining all of you today. I'm a senior program manager at the National Council of Juvenile and Family Court Judges. And I've had the privilege of working with juvenile drug treatment court teams for almost 17 years now, going on 17 years. And it's a great part of what I love to do at the National Council is help direct service providers, so meaning judges, prosecuting attorneys, defense attorneys, probation officers, treatment providers, all these people who work with youth and families in their communities, help them do the best that they can to serve those youth. They're such innovative people. I love working with them and sharing their innovative ideas. I really consider them the experts, and I often learn much more from them than I think I teach them. But it's a great joy to work with them. And Judge Capizzi here is one that I work with quite often. And I will put that as learning from him much more than I probably teach him too.
Martha.
That's great.
I don't think
Thank
so.
you. Thank you so much. We are really thrilled to have the opportunity to speak with all of our panelists today and continue the conversation. As I mentioned earlier, today's podcast is a continuing conversation from the live cafe conversation that we conducted about a month ago. We had such tremendous participation during that live cafe conversation that the panelists did not have enough time to answer all of those questions. So to remedy that, we figured we wanted to bring everybody back together along with Wendy Schiller and continue that discussion today. So we're going to go ahead and dive right in about some questions we received regarding mental health. So the question is, I know there's a lot of research regarding juvenile justice involved youth having crossover with the community mental health system. What improvements do you think need to be made in juvenile justice and mental health to improve outcomes for this population? Dr. Blomquist, Martha, I'm going to go ahead and start with you.
Thank you, Kelly. Well, that is one area where we are making some strides in terms of evidence-based treatment. It is recognizing use when they're in adolescence, the emergence of mental health issues that may be triggered just because of, for some individuals, as I mentioned in our last conversation, adolescence can be a time when mental health disease does manifest, but also keeping in mind that youth who have experienced the child welfare system may, from their own family context, if it's abuse or neglect, can have traumatic experiences. And so I think that we're getting more sensitive with the ability to assess individuals for adverse childhood exposure or experiences with ACEs, that we have a way to tap into what trauma and what mental health needs there are, and then how to address them. And one of the things that I think in the context of maybe family drug court and also juvenile drug treatment court is with the professionals in their assessments, being able to develop a single plan of treatment so that there isn't a disparate, people over here are doing one thing and professionals over here are doing something else and they're not communicating. The importance of having a plan, a treatment plan, where all the professionals, the multidisciplinary professionals, are talking with each other about the plans and the goals and individualizing it to you.
That's great. Thank you so much. Wendy, would you like to weigh in on that question too?
Yeah, I'd be happy to. I echo what Martha said, but also on sort of like the process side and thinking about the way we work with youth and families. There's lots of things that the system itself can do to help these youth and families sort of navigate this process. So if they are, if we know that they have mental health challenges, there's many things that we can do to help them navigate that, and that just flows right into being able to understand what those mental health problems are with good assessments and clinical partnerships, and then that comprehensive treatment plan that's just paramount to putting that in place, where maybe if a youth has more mental health challenges, we're not so focused on compliance. Rather, we're focused on filling that treatment need, helping them build skills to help them be able to learn how to deal with those mental health issues. And that could be as simple as getting them in contact with physicians, where we can help them get medication that's needed. And I know Judge Capizzi has a specific docket that focuses on mental health, and I know he has a lot to add here.
Well, Wendy and Kelly, all of you, obviously I'm here for the practical side of what's happening, and I still have a family treatment court and I have the juvenile treatment court, but I did find a lot more youth coming into our court systems that had some mental health issues, and so I created a separate mental health court, which we call the Life Court, and I have a whole separate part of my court now that manages young people who have mental health challenges behavioral health issues being different, the mental health challenges, or the drug use, the SUD issues. And so you need to make sure that you have a court that's trauma informed. You have to understand that the young people coming into the court system have had such trauma in their lives. And then, as both Wendy and Martha said, the assessment is key. We work with our treatment providers in this community to have very, very specific treatment assessments done, and specialized treatment for each. And so, I think it's critical that you as a court understand that these kids are coming into your court with mental health challenges, with trauma in their lives, and then you need to assess what those damages are to them, and then work with them. And the last thing I'll say is, take it out of the criminal mindset. We should be treating these children as children and treating them as young people who have mental health issues. I will say this, I have kids in my drug court, my juvenile drug court, which break the law because they're stealing and doing things like that to pay for drugs. But the young people in these communities that have mental health issues, they are breaking the law, but their charges really aren't drug possession. Their charges are assault. They're assaulting a teacher. They're assaulting a parent. Domestic violence. And those aren't crimes. We need to understand these kids aren't committing crimes. They don't have the mental abilities because of challenges to manage it. And so I think you have to get over that, because I think new judges, new magistrates, and probation officers think if you break the law, you're a criminal. And especially this sector of youth, they're not. And focusing on the way to prevent them. And the last point is, you give them drugs. It's a little different. And I had this personal challenge when I took over and created the Life Court. Because in a drug court, your goal is to keep kids off drugs. But frankly, in a mental health doc, your job is to keep them on their drugs, is to keep them stabilized on appropriate prescription drugs to make them stabilize themselves. So I think that's the challenges all over the country as we distinguish a child who's using drugs improperly or a child who needs drugs who need to be maintained and stabilized. Thank you.
That's great. Thank you so much for sharing. I appreciate that perspective about treating kids like kids, because that's what they are, and then recognizing where they are along the developmental spectrum, and being able to assess correctly to meet those unique and complex needs for this particular population of adolescent youth. So I appreciate that. Let's move on to substance use disorders. Janelle, I'm going to direct this question to you. For others, do you have anything that you would like to share about serving youth with severe substance use disorders? What does the research say? What practice-based evidence can you share? And do you have a particular recommendation for those cases?
Thank you. So it actually ties into the conversation we just had. If you don't have a really good assessment that includes mental health, socioeconomic, family living, all of that, you don't have a good assessment, you're not going to be able to develop a comprehensive plan. It's really important for these youth, who are youth and don't understand the consequences of their actions yet, is to put a plan together that they're a part of. And once the assessment's done, you do your intake with that youth, and what motivates you, Johnny? What do you like to do? What do you not like to do? Most of them will say, I don't want to be here and I want to keep using drugs. So actually tying it to, well, you are here, so how can we work together so you can be successful and we meet your needs and you meet our needs in your time frame and your process. Some of the things we do to youth, we've applied an adult model on, particularly with treatment courts, where you require a certain amount of sobriety for youth, consecutive. We did cumulative. So when they missed a UA, it was, oh, you don't start over. It was, we know you had a slip. We know you can do it. Let's motivate you that next negative UA. We will incentivize you. And those are the really important things. And we used to use the term bribe as opposed to incentive, but it is what motivates that youth. Do they like to skateboard? So if you can have, a month of sobriety, we'll hook you up with a skateboard or something like that. But it's really tying that whole plan together and making sure everyone on the team knows that plan, the family knows that plan, whoever that family is. It might not be parents, but whoever the family is the youth identifies, really understand it, and we wrap our arms around that youth and walk them to adulthood.
I love that. Thank you so much, Janelle. I agree. I mean, making youth part of the plan and giving them a voice in their And their treatment plan is incredibly important. And I really like how you integrated in the point about, behavioral benchmarks and not so much just checking off boxes, and then using incentives too as an engagement tool. That's great. Next, we're going to go ahead and move to violent offenses. We received several questions on this particular topic. So, Judge, I'm going to start with you. How do you address children, these adolescents in your court that have committed these violent offenses? And can you speak at all about the consequences of juvenile waiver?
Kelly, those are like 9 different questions rolled into one. Obviously we have a lot of youth committing very serious violent offenses, and we have to, it goes back, we touch them not before they've committed the crime. So the court system first sees that child once they've already been charged with something, generally speaking. And so we're dealing on really separate tracks. One is dealing with the criminal aspect. We know juvenile law is not criminal, but the delinquency aspect of that child, and then also the treatment of that child. And so you have to hold that youth accountable for what they may have done, be it 1 or 3 serious violent felonies. But you also have to find a different approach to treat that child. And again, we're going to talk this all day about assessments. But in every case, no matter what the problem is, be it a substance use disorder or mental health disorder, or just if they psychotic, antisocial, whatever it may be, to best understand how to treat that child who is committing a violent offense, you have to clearly understand what their needs are and then treat them for what they need. Now, on the issue of waivers, I am adamantly opposed, and a waiver, in my mind, that's a phrase for having a child transferred to adult court for commission of a violent crime. I'm very much opposed to any juvenile being transferred to the adult court system because, as I mentioned at the very beginning, kids are kids. They're not young adults. And so they should be treated as juveniles until the last possible moment. I've been trying to go around the country and argue that there should be 3 separate tiers, frankly. We should treat a child who's under 21 a certain way, and treat a child from 21 to 26 a separate way. You become full adulthood at age 26. And that goes back to the brain science issues of when a child's brain is mature enough to be responsible. So I've taken the position in my court, I will not transfer. Let me take that back. Over the last 16 years, I think I've transferred 2 youth prior to their age 18 when it was discretionary. But I really don't believe we should transfer any child. And as the years have gone by, I've become firmer in that belief that we always treat a child and give them assistance if we know what their challenges are and work with them. So it's mind-boggling to me that courts around the country believe a child that's 14 or 15 or 16 should be tried as an adult. It's disgraceful to me, really, but certain courts feel that way. And I think it's through education that we have to explain to these judges, the community, and the legislators that a child at age 15 doesn't understand what they're doing, and you can't hold them accountable for that. So are they committing violent crimes after they are? Where are they learning that from? They're learning it from the parents or grandparents and TVs, whatever. But frankly speaking, a child at 14 doesn't have the ability to understand the distinction. And I'll blame a little of this, and I get in trouble when I say this. In many ways, I want to blame TV, internet, movies, because a kid sees an actor on TV on a Thursday night, they die in a TV show. On Friday, they're on the same show. They're on another show. And so they don't understand that death means what it is. And I know that sounds naive, but I really believe that after being on the bench all these years, these young people really don't comprehend the challenges and what they're doing. And they don't think it through. And so to hold them accountable as if they're a 27-year-old adult is really disgraceful.
Thank you so much, Judge. I mean, I love the point that you brought out about balancing the accountability aspect with the treatment approach, given, and then also talking about how you have to balance that within the context of their brain development. So that's really important. Thank you so much for answering that question. Wendy, this question is for you. What are some things that practitioners and agencies should consider when they are serving crossover youth that have committed violent offenses?
Yeah, thanks. I'd love to interject. I was just about to chime in, but I was waiting for an invitation. I also want to say that much of the research that we have about what works with juvenile justice and with our youth Martha mentioned this during the last session where she said we know so much more now than we did, is that even with really high-risk youth, lots of the interventions that we put in place can change their behavior, change their peer association, change their attitudes and beliefs. And those are the things that when we target interventions towards those things, we have the best chance to reduce recidivism. So reduce the likelihood that they're going to offend again. And that's with those interventions, not with punishing violent behavior by putting them in detention or into corrections, but actually putting in services that target those beliefs, that give them new skills to be able to be a part of society as sort of we want them to be, good citizens, belief in authority, belief in accountability, right? And so that's exactly right what Judge Capizzi said. We're kind of balancing this. We have to hold them accountable for that behavior, but the thing that we know is going to help them change their behaviors and grow into a participating adult in our society is those interventions and skills. And we know from the research that that's true, even with really high-risk youth.
Great. Thank you so much, Wendy. I really like how you talked about and emphasized how the interventions really do need to be targeted towards behavior change. And considering those stages of change when it comes to behavior, all with the goal of reducing that recidivism and taking that strengths-based approach versus a punitive approach when working with crossover youth in particular. That's great. Janelle, would you like to elaborate anything or add to that conversation too?
I agree with Wendy and the judge on what they said about modifying the behavior. I do not believe detention is a place for any youth unless it is an extreme community safety issue. We had an example. I had a status, a non-offender treatment court at one time, and we had a 13-year-old young man who all he wanted to do was hang out with his friends and smoke pot. So he ended up being put in detention. Now he has new friends, and they were out committing crimes like mad. So putting him in detention, all we do is teach them things that we don't want them to learn. And putting them in an adult court is even worse because in my mind, we're putting prey in with predators. So I really think it's important that we focus on the behaviors, what brought them to us. Most of them have been victimized and traumatized. And again, tying mental health in, even if it's mental health counseling, peer support, something like that for that youth to work together on and work with the team to help move them to adulthood and preferably to 30. I know we stop at 18 and say, oh, sorry, you're an adult, good luck. I think that's wrong. And I agree with the judge that 26 or 7 is a much better benchmark for adulthood. And hopefully we'll get there soon.
Right. Kelly, can I add one more point that
Of course.
Janelle just really said a very important point I want to just double down on. And that is not mixing kids together. We have a lot of communities around the country that create their drug courts and put a kid in who has one joint, a first-time offender. And that's not the kind of child that goes in or should go to a juvenile treatment court. And all the national studies show that the deep-end children are the ones that are most successful in all these kinds of specialty dockets. So as she just described, having that little 13-year-old mix in being in detention with 17-year-olds, it's the same thing. If you put a child in a treatment program and they are a first-time offender, their chance of getting better is probably just the opposite. They get worse. And so the children we put in these deep end, and so even all these kinds of kids, the kids that have major substance disorders, those are the kind of children that should be in these kind of treatment courts. And the kids that commit these violent crimes, again, should not be mixed with kids that don't do that, but they should be put in groups of youth that are similar, because as Wendy talked about, there's a lot of treatment opportunities now to help these children. And the studies are showing that if we focus the treatment on the children that need that kind of particular treatment, they can be successfully rehabilitated. Thank you.
Yeah.
That's great. Thank you so much. All of you brought up some really great points, particularly about being behavior focused, trauma informed, and really thinking about matching that service to need, particularly when you're in a treatment court setting, for sure. I know we see the same thing in family treatment court where, matching service to need is really vital to a parent's and a family's success. So I appreciate bringing that point up. We're going to go ahead and move along to youth engagement. And so, Martha, I'm going to go ahead and ask you this question and have you answer first. What do you do when you have a teenager who refuses to help, hides in their room, or will not talk about anything and says they're fine? And how do you meet that adolescent's needs?
Well, I work more with the provider angle rather than direct services. But I know that when we talk about evidence-based treatment or interventions, one skill set that is very effective with youth is motivational interviewing skills. And that is a way for the professional or practitioner to develop a relationship with a youth. And I think some of what's normal for adolescents is to have a barrier or some reactivity or resistance to authority. That's part of moving into their own definition of identity, and adulthood is a sense of themselves and not deferring to adults or being trusting of adults. So one of the issues that may be at play in a youth that's sort of non-responsive is a sense of why should I trust you? That the individual who's non-responsive may be deeply hurting and in a lot of pain, mental health issues, trauma, what have you. And so the professional that's skilled in motivational interviewing and there are specific strategies and tools that person can use to connect with the youth. And I think that the main thing is trying to create some bridge of trust, and not that this adult is going to impose their notions on this youth, but that person is trying to evoke from the youth what they care about, what they're worried about, and what their hopes and dreams are. So that's what I would just say. But I don't work directly with youth. My background is not in psychology, and I've not been a clinician. So maybe Janelle, who has done some direct services with youth or overseen clinicians who do that, would like to speak to that issue. But I know that it's challenging, and even the really skilled practitioner can run into walls with youth who are non-responsive. But I think here's where we also need patience and understanding. This is like such adolescent behavior. Even people who have pretty happy, healthy home lives, when they're raising their own adolescent children, and many people in the panel here can speak to this kind of non-responsive, non-connectivity, separation from adults is part of adolescence.
Yes, and it's as if you were reading my mind, Martha, because Janelle is who I was going to call on next. If you could talk to us about this particular topic area and engaging this population of youth.
And thank you. And Martha, I do agree with you. We really need to be able to define, is it just a teenager, or is it actually some other deeper behavior we need to address? And to get the entire team to understand the difference and to recognize it. Motivational interview is key. I required that everyone on the team, including the judge, had some exposure, if not complete training in motivational interviewing. So that could be practiced from the bench as well. The entire team could practice it. One of the other things we've done when you have that, I'm just not connecting with maybe the probation officer or the treatment person for some reason, and not just because they're being a bit obstinate, but there's a true disconnect. They can't build that relationship, to find someone else who they can. But have that conversation about why we might do that. It's not just because we're giving you something, but you truly can't connect, and that comes from the clinician as well, that you cannot connect with this youth. Let's find another one. You can't have, say, a male talking with a teenage girl, and she has body image issues and sexual issues, and that's just a bad fit. So how do you make sure it's a good fit for that youth so they will reach out? Another way is youth peers. If you can get a good youth peer to sit down and talk to that youth and maybe get that first foot in the door so we can start having those conversations and then share everything that you can with the team. We also didn't necessarily share all details with the team because you were working on a trauma, but the team doesn't need to know the depth of the trauma because we're not going to be going into details about rape or trafficking or things like that for the fear that it might be mentioned in the courtroom. So we tried to keep things quiet. But another thing we've done is actually connected youth with an adult who has gone through the same system, through a juvenile court or an adult court, who met all the requirements for working with the youth, of course, because that's somebody who's walked the same path and they can relate more. I always said, I have not used drugs, I've not committed a crime, how am I relating to you? Because I'm not standing in your shoes. So let's find somebody who can help understand that and take that next step, open up that door, and now they're more receptive to everyone helping.
Kelly?
Great. Yes, Judge.
Kelly, I'm going to
Please.
add one more point to that, which hasn't been addressed yet, and that is when we're dealing with a child and we're trying to get their engagement, a lot of it's getting their parents to be engaged too, and that helps. And so we've created both, we have like a mentor for the child. We have a natural helper, which is a facilitator between the child and the parent. We've also created a parent alumni group for families that are dealing with it to talk to a parent who has successfully gone through the program. Because I think the child engagement is critical, but if you don't build that relationship between the child and the parent and build that trust, the engagement between you and the child itself has a lot of negatives to go up a hill. I mean, if you're trying to engage with a child and the parent keeps on saying to the kid, that probation officer doesn't love you, they hate you. And so I think getting the parental involvement is critical to child engagement too. And we have those ways of getting the parents more involved. We actually even have, and we joked about it earlier, we have incentive programs for young people in treatment court, of course. We have incentive programs for adults. If a parent is coming to the treatment court program, we'll give them a $25 or $50 gift card to pay for gas. So we've learned over the years that you have to incentivize not just for the children, but for the parents to get the families engagement. Because youth engagement isn't good enough.
Good point, Judge.
Yeah, that is a great point. I love that, how, you know, it's looking at this population through more of a family-centered approach instead of just treating the youth. You have to really make sure that you're engaging and treating the whole family so that they don't come back, right? I mean, that's the goal, is that they don't come back. So thank you all so much. You know, Janelle, you talked about that, the peer mentorship piece of it and the youth mentors. We did get a question about the importance of youth mentors and if there are any specific resources for teams and mentors that you can share with us during this discussion and that we could post on our website.
There actually are a host of trainings for mentors. We had a federal grant and we actually put a mentor program together with that, partnering with a youth organization who actually ran it. We tried Big Brothers Big Sisters and they were hesitant to deal with our population. So we brought our own mentors in and put the program together. It's key that the mentor understands the youth. We discovered that if you have retired grandmas, the youth are most likely going to take advantage of that. It needs to be someone closer to their age, or maybe like a big brother or an uncle or aunt, or someone a little closer that doesn't look like a parent, doesn't look like a judge, doesn't look like a probation officer. But there's a list of them, and I will gladly share those with you. You can go out and just put mentors for youth in the criminal justice system or the juvenile justice system, and a giant list will pop right up. But I can share that with you, Kelly, so we can post it.
Perfect. Thank you so much.
And Kelly, if I could jump in on that,
Sure.
there's actually a national mentoring resource center, and I can provide that website to you as well. And the National Council does have at least one technical assistance and report on mentoring, especially as it applies to juvenile drug treatment court. So that the question and seeing mentors as a resource is really great. We know with adolescents, especially if they're withdrawn and having trouble trusting, that this other avenue of developing a relationship with somebody around shared interests and fun can be a way to help the youth feel more relaxed and more confident in coping with the system, the legal system, and have a more open attitude towards the other adults that they might have to work with, as probation officers or the judge or what have you. And on that note, I did want to follow up, especially with the mentor piece, which is a good fit, just like with what Janelle was saying, even with the professionals, a good fit is not only gender, but also race, ethnicity, and sexual orientation. That can be really important for youth to have someone who's an adult, who is successful, who's a nice, fun person to be with, that's a role model and somebody that they can connect with. So considering those, just a range of things for the characteristics and qualities of the mentor, as well as the professionals who might be working with each youth. And we know that there's, youth of color and sexual minority youth have a lot of bad experiences on the child welfare side and the juvenile justice system side. So they have a lot of reason to be distrustful and scared, actually, of sharing themselves or depending on adults or being compliant with adults, what adults want from them.
That's a great point. Thank you so much for it goes back to sort of, that service, then the need, and is making sure that you've got the good fit between mentors and the youth that they're connecting with. Wendy, Martha mentioned, and CJFCJ does have a youth, some TA resources around youth mentoring programs. If you could speak a little more about that.
Yeah, and I did put the link in the chat to the mentoring in juvenile treatment drug courts. It was done some time ago, and it basically assessed the juvenile drug treatment courts that received a grant from OJJDP to actually augment their juvenile drug treatment courts with a mentoring aspect. So it has some good information there about what types and what that means. And my piece of advice for juvenile drug treatment courts, or any court that's supervising kids, is to make sure that it's youth-led. I think that when we hear the word mentor, we think, oh, everybody gets a mentor, right? Everybody gets a car. You get a car, you get a car, you get a mentor. And just like what Martha said, some youth aren't going to want that or benefit from it. And so you have to think about it as, I have this option available to you, and I can assist you in helping you navigating how do you self-identify a mentor? How can I place you with somebody who will be helpful to you? But simply mandating a mentor as a piece of your supervision strategy might backfire.
And if I might add on that, of the mandate versus not, another untapped resource sometimes could be someone that the youth already knows and cares about, and who cares about him or her. It could be a family member, it could be a neighborhood person, it could be someone with a church, and identifying to the court team, if it's with Judge Capizzi's program or some other program, that this is a person, maybe their parents can't step in and be involved in the parental engagement piece, but this other adult can be, or this other adult could go through the mentor training and be viewed as a mentor. And so that automatically can give the youth a better feeling of their voice, their choice, and then some comfort in the whole process and who they're connecting with. So I would just say that either someone that the youth already knows, to bring that person into a formal mentoring program where there's training, or to bring that caring adult into interactions with the court whenever parental involvement or adult involvement is being looked into or wanted.
Kelly, I know it's a different issue, but Wendy's Wonderful Kids started in Ohio, and it's a way to have children adopted, and it really focuses on children who are 12 to 18 for adoption. Different issue, but they have found that the most successful individuals to adopt a child are the people that may have been touched them once, may have been a teacher, may have been a sports coach, may have been a neighbor. And so you can pull that study that shows that that's exactly the right answer, that there are so many people out there that the youth knows. The youth doesn't even understand how many people love that youth. They only see their parents may not love them or may not understand it. And so by doing the research, by doing a proper assessment and then planning to the probation department needs to reach out and ask the youth in this motivational therapy and just trying to figure out who's in your life, and then go out and look for people that are willing to be mentors, but who've never been asked.
That's a really great point. I love how you've brought up the, doing that assessment to really find out, is there an existing adult in that young person's life that they can rely on, that they have a trusting relationship with, not only to help with, the mentorship and reducing recidivism, but Judge, as you just mentioned, it could also lead to permanency as well, which is, is the primary goal when you're talking about a dependency case. So, this is a great conversation. And Wendy, I'm going to go ahead and take the link from the chat after this discussion and make sure that we include that in our resources too as well. So thank you for sharing that. Let's move on to systems of care. And I'm going to call on you, Martha. Can you provide some strategies for systems and community re-engagement as it relates to the principles of systems of care?
Well, one of the things, and Judge Capizzi can speak to this more directly, but I just want to highlight the role of judges in their communities as leaders, and judges as leaders being able to connect with other systems, whether it's this educational system, behavioral health system, medical health system, to reach out to various stakeholders in the community to create collaboratives around what are the needs of our families in our community, what are the pressing issues, and how can we work together to address them. And especially these days with a lot of protests around law enforcement and police responses that are overactive and violent, is the awareness of there are other ways to respond to needs and individual citizen behavior that threatens themselves or other people. We don't have to have the heavy duty law enforcement punitive control response from law enforcement that can be counterproductive. And so having a collaborative approach to identifying what are our needs and then what do we have as resources, I think is a good way to begin, and then have the connections so that people get connected to non-court, non-legal responses, probably most of the time for most of their needs. And even redefining something that was perceived as a public safety issue as a public health issue. And then with that redefinition, you begin to have a whole different view on what the solutions are. So that the court system is just part of a whole range of systems in a community that are resources to solving problems and helping, citizens be the best that we can be with each other.
Great, thank you so much, Martha. Yes, I love how you hit on judges as leaders and conveners, and it's as if you're like in my head, because I was going to reach out to Judge and ask him if he could share some strategies about systems and community re-engagement that you've seen and done in your jurisdiction.
Sure, Kelly. I think it's really clear, and I try and teach this around the country for the National Council, that right or wrong, judges can be the leader and should be a leader in the community, especially as it relates to children and family issues. And so the judge has the ability to bring people together to convene, as Martha talked about. And in that process, the judge needs to have the ability to convene but not lead. I'll say it again, to convene the meeting but not lead the meeting, because you can't tell people what they need to do. You need to bring them into the mix and make them be part of the package. And so there are so many silos in the community: VEH, regular doctors, education, the police. And the judge's role in the system of care scenario was to bring all these barriers down, get rid of the silos, and create the teams necessary to accomplish the goal. We had that problem in Montgomery County with the heroin issues and how to deal with the opiates. And we came together as a community and brought all the different sectors together through judicial leadership and some elected official leadership. And we created teams to analyze the problems and find the solutions. And when you do that, you have a much better ability to pay for it. Because when you do that, you're getting buy-in from everybody. And then the system of care comes together and treats a family. You can't treat the wound on a leg if they got 47 wounds on their body. One isn't good enough. So if you just treat the child who has a broken knee, you're not solving the problems of the family. And having umbrella services of every type as early on as possible, using a system of care and cooperation, you can solve educational issues, socioeconomic issues, medical issues, behavioral issues, and really deal with some of the social problems in our communities that are coming together as teams.
Mm-hmm.
That's great. Janelle, did you have anything you want to add too?
I think it's really critical for drug court teams to have a community advisory committee that meets on a regular basis. It gets back to what the judge was saying, that the judge can convene, but let's let that community lead those conversations. And by starting with a community mapping, so you know every service that's available in your community for your population, then you have that menu to pick from. So when you've done the assessment for the youth and you're looking at the needs that this youth has, whether it shows up in the assessment or the youth has articulated something that didn't show up, you know what's out there, and you've already built those partnerships, so you can reach out and say, well, I need this service and this service and this service for this particular youth, and you build those partnerships, and then you're improving your community as a whole, and you're also really putting that continuum of care together for the youth, so we meet their individual needs in a larger system.
Mm-hmm.
That's great. Thank you so much, Janelle. I love how you all have talked about judges as leaders and conveners and barrier busters, and just engaging and doing that community mapping to be able to discover the resources in your community to establish those systems of care and treat families in a more holistic manner. So in the interest of time, our last question is regarding funding. So I'm going to go ahead and throw the question out there, and then anybody feel free to jump in. So the question is, they say the budget is the policy, meaning that if you want to really change practice, you need to change the budget and to change policy to support the programmatic change. So what kind of budget changes do you think are needed for youth involved in child welfare and juvenile justice systems, and how would they support the necessary programmatic changes?
Well, let me go against the group here, maybe. I believe that's just an argument not to do change. I believe that too many communities say, I can't do this because there's no funding. And I will tell you, when I started almost all the new programs in my court, I didn't beg for new funding. I got some new funding eventually once I proved what I was doing. But you need to analyze yourself, your court system, your staff. You need to refocus on the challenges that affect the kids, and you may reprogram things, but you can do most of that without more cost. Now, so I talk to judges over the country that say, well, Judge Capizzi, you have all this money. And I'm like, I don't have all this money. I beg for money around the country. That is true. But I also find ways within my own court system and my own budget to make things work, to reconfigure, to move two people from this department to that department, because that's the needs have changed. And so budget should not be the excuse for not serving the children and families that we serve. Be creative, be aggressive, go ahead and look out for those state and federal funding opportunities through OJGDP or SAMHSA or whoever. But in the end, you need to be creative internal to your organization and convince your leadership, your administrative leadership, that these new programs can happen. Let's reallocate, let's move, because new funding we know is not going to be there. And I will tell you that works. We've pushed, 15 years I've pushed that concept of not looking for new dollars until I've proven the program successful. Once you prove it successful, go out there, and then the money comes to you to keep it going and to enlarge it and to enhance it.
Yeah, I totally agree with you, Judge, totally. You can set policy without touching your budget or asking for more money. And I think a key piece is knowing your program and having the data to prove that you're being successful. So if you're not tracking your data, you're not analyzing it on a regular basis, and I know it's a lot of work, but it's a great way to prove you're making a difference. And you can get a lot of federal funding or state funding, whoever has the money, when you can say, these are the lives I'm changing, and I could do this if I could serve 50 more children if I had this money.
You know, that's exactly what happened in my treatment court. I had a very successful treatment court program. We went to OJJDP, and they gave us what's called an enhancement grant, millions of dollars to double the size of my treatment court, which almost killed me because of the effort I had to put into it. But the reality is exactly what you just described. By proving with your data you're successful, you can go out there, and let's not forget all the foundations. We've been able to get a lot of support from foundations around the country focusing on youth and children's issues.
Very true. And I had a large budget for all of my treatment courts, but I would just move money around based on the need. And because I could prove that my programs are being successful and here's where the need was, the court said, okay, but you need to be able to prove it. And I think that's key. And then you can do what you need with the budget you have.
And if I could weigh in on this too, Kelly, if we have time, one of the areas that I think is very promising in terms of reinvestment is shifting away from punitive policies that focus on securing public safety by using detention and out-of-home placement. We know those practices carry harms to youth long-term and short-term. They don't give us the public safety we think they're going to give us, and shifting away from, and those are very expensive strategies. Having youth in detention or out-of-home placement is very expensive. And if you shut those practices down, you have the money to move to support in community-based services, and that's really, we have so much information about what's effective in the community. So I would encourage that it really starts with what both Judge Capizzi and Janelle are saying is it's really the commitment to a certain policy direction and mission and vision of your court and your work, and then looking at what are the evidence-based practices that we could adopt that are consistent with this mission, and then how can we switch our funding streams to support the mission and the goals that we're committing ourselves to. So I've had a lot of experience with judges and court-led initiatives exactly about that, and the shift away from not using detention and then into this other practice area of committing to trying to keep kids in the community and investing in more of the services that already exist or working in a collaborative way to create the services.
And that's where a judge has to be strong, because the community sees you put less people in detention, less people in corrections. They want the money back. The county commissioners want the money back so they can reallocate it somewhere else. And we need to show our leadership in saying, yes, we're detaining less children, we're putting less youth in prison. Let us use that money for community-based services. Let's keep it in the system. Let's not send it to the parks or send it to, environment. Let's focus on children. So that's a strong leadership position the judge has to make to defend their budget and retain the budget when they save money in other areas.
Right. And I'll just add out, if I may, that's where this, Janelle brought up community mapping and a community advisory board. Just knowing what's out there, what is possible to fund, where you can see cost savings is so important to the concept of sustainability, making sure that the right dollars are allocated in the right place, taking advantage of larger systems that already have put things in place. So many times juvenile drug treatment courts are actively trying to find a risk need assessment that they can just implement in their docket. And I'll ask, well, what's your larger juvenile justice using? Oh, they're using the PACT. Oh, well, dip right into that. If your larger system's already doing it, don't spend money from an OJJDP grant to fund that. Figure out if your larger system is doing it already, and then allocate resources there.
Okay.
That's great. Thank you, all of you, so much for sharing. Yes, I mean, that importance of knowing your program and having that data to be able to show the success and tell that story, making the case to your stakeholders to be able to reallocate those resources that currently exist in your state or community, and how that is really going to support your sustainability efforts. And just the importance of connecting mission and vision to your goals and outcomes is so important. So I appreciate all of you weighing in on that, because I do believe that's a really critical piece for systems that are serving this population and families in general that are affected by substance use. So once again, I want to thank all of you for joining us. We appreciate both your desire and your commitment to better serve adolescents and their families. Thank you to the panelists for all of your contributions during the live cafe conversation, the prep for that, and this post-webinar podcast discussion. We also want to thank OJJDP again for their generous support. And for those listening in, if you have any additional questions about this or any other questions related to serving families affected by substance use disorder, please reach out to us through our email at fdc@cffutures.org. And we will be sure to follow up with you with a response. You can also view the live cafe conversation and related resources on our Teen Matters Learning Academy webpage at www.cffutures.org. Thank you again.